Guys, in this video I'm going to go over some of the bones. So first I want to show you this model of bone histology. So here we have our spongy bone. So these units here are the trabeculae in white, and then you see some of the red bone marrow. Here you have your Volkmann's canals, the ones that run perpendicular, and then in the center of our osteons here you have your haversian or central canals. Okay, and you could see how the Volkmann's canal connects those together. Okay, let me go in a little bit. So these openings here, those little like oval shaped openings, those are the lacunae, and those hold the osteocytes, those mature bone cells. And then you see those tiny little lines coming off of the lacunae, those are the canaliculi, those little canals. Okay, and then so here are our whole osteons, right? We have quite a few whole osteons here. And now let's go through the different lamellae. So remember I told you around the very outside, you have your circumferential lamellae, right? It's right around the circumference. This here in gray would be your periosteum, okay? Then you have your concentric lamellae. Those are the rings that make up the osteon. And then here we have our interstitial lamellae. So you see those rings in between the osteons here? These are the interstitial lamellae. Remember, interstitial means like in between. Okay, so I just wanted to show you that in a model. It's a lot easier to see than me drawing it out. Okay, now let's go through the bones of the skull. So we have the cranial bones, okay? So this one here would be the frontal bone. Then we have two parietal bones at the top. The bones on the side here are the temporal bones. So we have one on either side of the skull here. And then in the back and more underneath, we have our occipital bone, okay? This large opening here underneath the occipital bone, this is the foramen magnum. That's the space where the spinal cord passes through from the brain and down into the vertebrae, okay? Underneath the skull, there is a butterfly-shaped bone, so it's this bone here, okay? So we have a separate one, and I could show you all the different parts that you need to know. Okay, we have our greater wings. So these here on the side would be our greater wings. And then kind of above this here are the lesser wings, okay? So greater wings, lesser wings, okay? These here are the optic canals, okay, for the optic nerve. This here is the sella turcica, okay, sella turcica. So this is where this groove here, 43, this is the sella turcica. This is where the pituitary gland sits in this bone. Okay. Back here, we have the sphenoidal sinuses. Okay, so we have a few different sinuses. They help to lighten the skull. So this here is the sphenoidal sinus, this big kind of open space back here. Okay. So I believe, here, let's see what other openings. This one here is the foramen ovale. You see it's kind of more oval shaped down here, foramen ovale. Remember, a foramen is an opening, okay? Down here is the foramen spinosum, this little small opening down here. And then the foramen rotundum is this round one at the top. Then we have our ethmoid bone here. So this is found behind the nose. So if we look in our skull here, it's kind of behind the nose down there. So this is part of the ethmoid bone. It's like right inside the nose area, okay? So this is the bone separated, okay? All right, so in the middle here, this tiny line right here, this is the perpendicular plate, this line that runs down the middle here, okay? On either side of that, we have our superior nasal concha. These come out on the sides inside of the nasal cavity, and they have these meatuses underneath them where air flows through. You learn more about those when you get to respiratory system in A&P 2. Okay. Then if you go a bit lower, these would be the middle nasal concha down here, middle nasal concha. So superior and middle, the inferior nasal concha, you can see inside of the skull here on the sides. So this here labeled 56. Okay, that would be the inferior nasal concha. Okay, this, if you turn it around, this part that sticks out here, this is the crista galli. Okay, crista galli. And then just try to see what else you need to know for this bone here. These would be the ethmoidal sinuses. So these, these holes here would be the ethmoidal sinuses. So the ethmoid bone, sphenoid bone, frontal bone has frontal sinuses. They're named after the bones that they're found in. And the maxilla, this here's the maxilla, has maxillary sinuses. Okay. And then the sides here are the lateral masses. Okay. The part that comes out over here, this is the cribriform plate. Cribriform plate. Okay, so that's everything for the ethmoid bone there. Okay, now let's go back to our skull. Here, labeled 7, this is the nasal bone. Okay, nasal bone. Right on the side of it, inside, right like inside of the eyes, that's the lacrimal bone. Okay, lacrimal bone. So this little bone here, lacrimal bone. Okay. The cheekbones here are known as the zygomatic bones. Okay, and there's 2 of those. Okay. Here, this line at the bottom here is the vomer bone. Okay, just this bottom part. Remember, this top part is part of the ethmoid bone. Okay. Okay, we turn this underneath here. This here is the palatine bone, and this part further up here is the palatine process. Okay, so this makes up the hard palate. Okay, palatine bone, palatine process. Okay. Then coming back here, this bone here is the maxilla. Remember, we have a maxillary sinus within there, maxilla. Then there's a separate bone. I have to find it. This bone here, this bone does not, this is one bone that does not articulate with any other bone. It goes in the neck underneath the skull. This bone is an attachment point for the tongue, and it helps to hold up the pharynx. Okay, this is the hyoid bone, and it has a body. It has a body, greater horns on either side in the back, and lesser horns. These ones that stick out on top. Okay, so that's it for the hyoid bone. It's a pretty simple bone there. Okay, this fell off of my skull here, but this is the mandible. This is a modified hinge joint, the way it attaches to the skull, because we can move it up and down, and we could also kind of grind our teeth like side to side. Okay. These little holes here on either side, these are the mental foramens. Remember, mental means chin area. So these are openings where you have nerves passing through. Then in front here, we have our coronoid process, and then in the back here, this is the condylar process. So this part articulates with the temporal bone, and this coronoid process goes like underneath the cheekbone, or the zygomatic bone. Okay. Right underneath the teeth here, this area is known as the alveolar process, on the top of the teeth as well, alveolar process. Okay. This indentation here, this is the mandibular notch. Okay, and this is the mandibular angle. Okay, it's like that jawline area. Okay, now let's look at our sutures. So these are where the bone ossifies together in the adult skull. This happens around 2 years of age. Okay, so the first two are pretty easy. This one here, going across between the frontal bone and the parietal bones, is the coronal suture. It's like a coronal cut, right, the way it crosses. This one here, separating the two parietal bones, this is the sagittal suture. Okay, separating the parietal from the temporal lobe on either side, this here is the squamous suture. And then separating the parietal bones from the occipital bone, this is the lambdoid suture. Lambdoid suture. Okay, so you do need to know those suture names as well. Okay, now we have a model of the fetal skull. So there are what we call fontanelles. So these blue areas here are fontanelles. This is where we still have connective tissue. Okay, so this is dense connective tissue. And these are where the bone closes over by 2 years of age. Okay, so this one here is the anterior fontanelle. This is the largest fontanelle, so it's like the soft spot on the top of the baby's head. Okay, if we go to the back here, this is the posterior fontanelle. And then on either side, we have a posterolateral fontanelle, right? It's posterior and lateral. So it's named after where they're found, okay? And then up here, we have an anterolateral fontanelle. Okay, so those are all the fontanelles of the baby or fetal skull, okay?